Thank you, Dr. Hart, for joining us today on your talk on driving in dementia. Is it safe? Dr. Hart is a board-certified geriatrician with specialized training in memory care with Norton Neuroscience Institute Memory Center. She graduated from medical school at the Ohio University Heritage College of Osteopathic Medicine. She completed internal medicine residency at the Christ Hospital in Cincinnati, Ohio, and completed her geriatric medicine fellowship at the University of Cincinnati Christ Hospital program. As a geriatrician, she has training in caring for older adults in the settings of outpatient geriatric assessments, inpatient consults, geriatric rehab, long-term care, and geriatric house calls. I'm going to go ahead and pass it over to you.
Thank you. And thanks for joining us this morning. I wanted to spend some time talking about something that comes up a lot in our memory center with our patients and their families, and it's one of the really difficult conversations to have. So hopefully this will help shed some light and just give some guidance. But again, our talk is just called Driving in Dementia and Determining When It's Safe. So dementia requires multiple complex cognitive abilities, and not only just memory, but also things like planning, making decisions, judgment, and reasoning. And all of that cognition is required to help us to drive safely. So because of this, there does come a time when a person living with dementia will have to stop driving. And the loss of being able to drive is often seen as a loss of independence. So it's a difficult decision for both the person living with dementia and their caregivers. So hopefully by the end of this talk, we'll have some tips to help develop a driving cessation plan before the safety becomes an issue. So just hopefully by the end, these are just the objectives: to identify risks associated with older drivers, determine how to assess for driving safety, understand how to report an unsafe driver in Kentucky, and then navigating that conversation about no more driving. So a couple places in this talk, I just put up a couple of flyers on just some safety tips for safe senior driving. We're going to go through more of these during the talk. But this first one, just 5 big tips: anticipate changes that can affect driving. And that's where we'll talk about a lot of the risks that senior drivers may have that can put them at potential danger. The second one is having family conversations, starting the conversation about driving and driving safety early before an accident happens. Also involve your healthcare providers and make sure that our older adults do have screenings and evaluations that are needed to keep them safe driving, and help them determine if there's interventions that can make them better drivers, whether that's a training or whether that is some modifications to the car, interventions that they can do that can empower them as drivers. And then last of all, if an older adult can no longer drive, it's still important to make sure that they stay engaged in their community. So what puts older drivers at risk for driving safety? And a lot of these are going to happen just as a part of the aging process. Things change with an older adult's body. And the first one are the changes that we see with arthritis. So we get stiff muscles, we get stiff joints. And that arthritis makes it harder to turn the head, to look backward, to turn the steering wheel quickly, and even to brake safely. Sometimes these risks can be overcome by things like an older adult staying physically active, exercising, keeping and improving strength and flexibility. And sometimes an older adult may be a candidate for something like a hand control that can use the gas and brake pedals if their legs can no longer use those. Older adults are also more likely to suffer from vision loss. A lot of our eye diseases like glaucoma, cataracts, and macular degeneration occur for an older adult. All of these eye diseases make it harder to see people, things, and any movement that's outside the direct line of sight. This can also lead to taking longer to read specific street signs, traffic signs, or even recognize familiar places where they're going. And nighttime poses a specific risk because the darkness or the glare off of the other car lights can also cause more trouble seeing clearly. And sometimes these vision loss problems can be overcome by some things like getting an annual physical exam, doing an eye exam, updating any prescription lenses that are needed, and then just some safety things on avoiding driving during times where we are at the highest risk. So nighttime, again, glares from cars or street lights, and then also sunrise and sunset when the sun's directly in the eyes of the driver. Older drivers also are more likely to suffer from hearing loss. When you can't hear, it makes it harder to notice horns and sirens and even the noises coming from our own car. And these signs are really meant to warn you when you may need to pull over or get out of the way. So some things that an older adult should do, hopefully to combat some of this. Screenings for hearing evaluations are generally recommended every 3 years after the age of 50. Any hearing concerns that an individual or a family member has, addressing that early with a doctor. Does that mean you need a referral for an ear, nose, throat doctor, an audiologist? Do you need to be evaluated for hearing aids? And then the last practical tip is just keeping the inside of the car as quiet as possible while driving, just to avoid distractions. Older adults also tend to have slower reaction times and reflexes, and part of that is just a normal part of the aging process. Reflexes become slower. Sometimes attention spans can also be shorter, and that makes it harder to multitask or to do 2 things at once. Add on top of that the stiff joints or muscles that may be present, and then it's also harder to move quickly. Sometimes things like neuropathy or other diseases may make it more likely to have a loss of feeling in both the fingers and feet, and that may make steering more difficult or even reaching and using a foot pedal harder to use. Older adults may also have other medical conditions like Parkinson's disease or strokes that cause physical limitations and slower reflexes, and those disease conditions can make it no longer safe to drive. So for these slower reaction times, it is important for older adults to think about things like leaving more space between their car and the car in front of them, thinking about brake times, starting to brake early when we need to stop. And really some big safety things are just avoiding heavy traffic areas and rush hours, using 2-lane roads instead of fast moving highways when possible, or if highway driving is necessary, staying in a slower right-hand lane. And then also our older adults are more likely to be on higher numbers of medications. And a lot of our medications can affect driving and driving safety. Several medicines that we may take can make us feel more drowsy, lightheaded, or less alert than usual. And all of those things can just be more dangerous if we're driving or behind the wheel of a car. Some common medications that can cause these problems are going to be things like sleep aids, certain pain medications, some antidepressants, and some allergy medications, specifically ones that include Benadryl or diphenhydramine, and a lot of our anxiety medications. So when thinking about medications and driving safety, it's important to read any kind of medication label carefully and look for any warning. If it says take at nighttime or avoid use of heavy machinery after using it, that means it really shouldn't be taken before an older adult needs to take a trip for driving. And then it's also important to keep a list of medications and talk with a doctor or pharmacist about any concerns and how those medicines may affect the driving ability. And then the main thing that, when we think about it from a memory center that we worry about risks with older drivers comes down to those patients who live with dementia. And for a lot of individuals who are in the early stages of dementia, some people are still able to continue driving safely, generally in certain situations, things like driving locally, close to home, daytime driving, routine trips, places that they're familiar with. But as dementia progresses, both the memory and the decision-making skills become worse, and it's harder to continue to drive. And it's important to recognize that at some point, all individuals who are diagnosed with dementia will need to stop driving. And ideally, we recognize that time before a problem like an accident or a major event like getting lost happens. Unfortunately, with dementia, a lot of people who live with the disease are not aware that they have driving problems. It's usually other individuals like neighbors, maybe a spouse, family members that recognize the driving safety can become a problem. And it is important as family and friends that we start to monitor an individual's driving ability and take action as soon as a potential problem is identified. Some early warning signs are things like forgetting how to find a familiar place, somewhere they're very familiar driving, like the grocery store, or if they take a trip and just need to drive back home. Is it that familiar place? Is it difficult to find? And then another thing is, are there any unexplained dents or scratches to the car? Something that's new and you ask the individual about and we can't remember how that dent came. Those are some things that just some early warning signs to start looking at driving safety. And then the other thing to recognize with dementia is that dementia is not just short-term memory loss, but because the dementia can affect problem-solving skills and decision-making, it affects a person's abilities to make decisions safely about driving. And dementia affects the part of the brain not only involved in remembering, but understanding consequences and processing information. So this scenario is not an uncommon one and it's heard very frequently, but a woman who drives too close to the car in front of her fails to stop at a red light. And the car in front of her stops, but she hits the back of the car because she doesn't stop at that red light. And her son tries to talk to her about this accident, but she doesn't remember the details. She doesn't understand why he's making a big deal of this because she says she's a good driver. She's always been a good driver and never had a car accident. He wants her to stop driving, but she doesn't think this is needed. And this is where that disconnection can happen with someone who has memory loss. Not only does she not remember the details about the driving car accident and hitting that car in front of her, but she doesn't really understand the consequences of, if I did this once, might I do it again, or might I hurt someone or someone else? So just kind of a recap of some older driver safety. Things to think about with risk factors, the things that we can control: always get vision and hearing checked, check any memory assessments that are needed, and reflex times, know what medicines you should and shouldn't take before driving. And then when you get into your car, keep it in safe driving condition and avoid any problems that can come up with the road. So how do we assess a driver's safety? So the first thing really comes down to having someone, a caregiver or a loved one, getting into an individual's car with them. And it's important to note that if that individual really drives locally, very few places, a 5 to 10 mile radius, that's what they should be driving with that caregiver or someone in the car with them. But they should be driving with them probably a couple times a month to start with, just driving in their routine places and just monitoring for any kind of warning signs. Some of those warning signs that a caregiver or a loved one may need to start looking for. Does this individual forget how to locate familiar places? Something like going to their beauty parlor that they've gone to every week or every 2 weeks for the last 20 years. Do they fail to observe traffic signs? Do they make slow or poor decisions in traffic? Do they drive at an inappropriate speed, either too fast or too slow? Do they become angry or confused while driving? Do they hit curbs? Do they use poor lane control? Meaning that if we're in the right lane, do we constantly go over the middle line, over that middle line and into the other lane? Or do we make errors at intersections? Do we confuse the brake and gas pedals? Do they return from a routine drive later than usual? Meaning, if it takes 10 minutes to get to Kroger, they went in for a few things on a list. We expect them back within 30 to 40 minutes. Does that trip now take 2 hours to do? And then last, do they forget a destination that you're driving to during the trip? So if you as a caregiver are driving, do they forget what that destination is in that short amount of time? And so if you or a family member notices warning signs like this, it is important to discuss that driving safety with the doctor. And dementia does affect each person differently. There's not, one memory test score. There's not one stage of a dementia, one specific age where we can make a blanket statement that now is the time for this individual and all individuals at this time point to stop driving. Every person with dementia does interact with the disease differently. So that time on when to drive really has to be patient specific. And oftentimes the best way to look at this objectively is to do something called a comprehensive driving evaluation. And that's really the best objective indicator on whether someone is currently safe to continue driving. So most comprehensive driving evaluations are generally done with occupational therapists. And those driving evaluations really have 4 goals. First, to identify your strengths and any changes in vision, physical ability, or cognition that can pose a risk for driving safety. Second is just to recommend how you might strengthen any skills, compensate for weaknesses, and develop a relationship with a driving specialist to work with to explore every option to keep them safely driving. Third is to prioritize your goal to continue driving safely, but recommend a plan to stop driving now or in the near future if changes in your skills and abilities are too severe, placing you or others in the community in harm's way. And the fourth goal is to remain focused on transportation and participation in the community. Occupational therapy professionals can work with you to identify an alternative mode of transportation that could work for you and provide the support you might need to get where you need to go when you need to get there. And what to expect during a driving evaluation. So most driving assessments take about 2 to 3 hours to complete, and they're conducted one-on-one with an individual driver and an occupational therapist. And there's 3 steps involved with their clinical evaluation. The first one is the off-the-road portion of the test, and that really involves assessments looking at cognition, vision, and then physical assessments. Cognitive skills can be looked at as far as judging memory, judgment, and attention. Some of those are going to be done with a clinical interview. They may walk through driving scenarios. There's a detour, or there's a road out because of bad weather. Tell me what we need to do. They may have pictures of driving signs or traffic lights and have to walk through with occupational therapists what each of those mean. And visual assessments really check things like depth perception, peripheral vision, and visual spatial skills. And then the physical assessments are done very much like a physical therapy assessment would be, to really assess an individual's strength, muscle flexibility, and their endurance. And then the second part of the test is an on-the-road test where an individual driver drives an instructor's vehicle. And that instructor's vehicle has a passenger side brake and often has a passenger side steering wheel as well. And then the last part of the exam is the oral feedback and a written report. And those results and a plan are then shared with the individual driver and a caregiver or anyone who comes to the assessment with them. That report is then written up and then also shared with a medical provider or whoever made the referral to have this driving evaluation done. And the plan is always gone over with the patient or the individual and outlines circumstances where they should continue to drive or where they need to stop driving. And then there's generally 4 outcomes of the driving evaluation. Sometimes if the driving evaluation goes very well, the outcome is just to continue to drive as you are. Sometimes the outcome is continue to drive, but with certain limitations. It may be avoiding highways, it may be avoiding nighttime driving because they have some difficulty with depth perception in their vision assessment. That limitation may involve adding adaptive equipment to modify the car for safety. Do we need to change the height of the steering wheel? Does there need to be some kind of modification like a hand control to a gas or a brake adjustment? And then sometimes it's actually that the car is identified that car may not fit that specific driver. So is the car a good fit for you? Is it easy to get in and out of? Is there good visibility? Can you see out of the mirrors and out the windows? And does it have appropriate safety features? Sometimes it's not the driver that's unsafe driving, but it's the specific type of car that they're driving in. And if there's a way that the car can change, or they can find a better car that's more suitable for them, it may be safe for them to continue driving. The third outcome is the need for driving rehabilitation. And those are often the individuals who've had an event like a stroke or an orthopedic surgery, something that we expect they need to recover from. And that may involve therapy like physical therapy or occupational therapy services, needing to get them back on their feet so that they are in better health to return to driving. And then the fourth outcome is that the recommendation is that it's now time to stop driving. So in Louisville, there's 3 driving assessment programs that are conducted with occupational therapy. There's one at downtown Norton with our hospital. Fraser Rehab has a site out on Newburgh Road. And then there's a private company called Drive Abilities that has a site in St. Matthews. The driving evaluations do generally require a referral from a medical provider, a nurse, or an advanced practice nurse practitioner. But the referral is made, and then these 3 individual agencies will then contact an individual and family member to set up one of those assessments. And then there are situations where an individual does complete a driving evaluation. The recommendation is that it is time to stop driving. And that individual may not recognize or may not agree with that recommendation, and they continue to want to drive. We also have individuals who don't recognize the need for a driving evaluation to determine their safety, and they may just refuse to complete one. So in those certain situations, there is a way that an unsafe driver can be reported in the state of Kentucky. Kentucky has something called the Medical Review Board program. And this medical review board identifies drivers with any physical or mental impairments that can hamper their ability to safely operate a motor vehicle. The medical review board consists of medical specialists in ophthalmology and neurology, psychiatry, and then they also have rehabilitation specialists. The board members provide the medical advice to the Division of Driver Licensing on licensed applicants and licensees that are reported to the board. In Kentucky, drivers may be reported to the medical review board for any of the following reasons. If the driver has indicated that they've experienced a medical condition like a blackout, a loss of consciousness, or suffered a seizure. If the driver's been reported by a physician, a Commonwealth attorney, a county clerk, a circuit clerk, a sheriff, or a judge as being incapable of driving safely due to physical or mental conditions. If the driver's official record kept by the transportation cabinet indicates the possibility of a physical or mental impairment, or if the driver has been named in an affidavit to the medical review board by at least 2 citizens as being incapable of properly operating a motor vehicle due to a physical or mental impairment. And the state of Kentucky does have a website where they have a link to this PDF document, and this is what that driving affidavit is. It's a 1-page document that can be completed by the physician, by an attorney, a clerk, a social worker, a family member, a concerned citizen, such as a neighbor. But it really just lists who the individual is and what safety condition has been identified. If the physician fills it out, they'll document things like history of a stroke or history of being diagnosed with Alzheimer's disease and poor memory. If that affidavit is completed by a physician, it gets sent to the medical review board. If it's filled out by an individual like a family member or a neighbor, it does require a notary to sign it before it's accepted to the medical review board. But that's the first step in reporting driving safety. So once this gets to the medical review board, a case is open for the driver, and that once that case has been created, the appropriate medical forms are then sent to the driver and then also sent to the physician to be completed. After the physician completes the information, it's reviewed by the medical review board, and then the individual is notified of the board's decision to revoke the license or not. The board may revoke the license. The board may require a driving evaluation if it's not been completed. And the individual has the right to refuse to do that driving evaluation that's required. But if they do refuse, then the license is revoked after that. And then the last thing I wanted to just cover is how do you navigate that conversation of no more driving? And I recognize that this is probably one of the hardest conversations for most of our patients in our clinic when we have advanced memory issues and we can't drive anymore. But a loved one who has received news that it's no longer safe to be on the road may not want to retire from driving for several reasons. And the most common ones are difficulty accepting that they can't do something they used to do, a feeling of loss of independence, a desire not to burden others, a lack of trust in their caregivers, or that sense of that they have a loss of control. And these are just some tips on how to maybe start the conversation or how to get a loved one on board when it isn't safe to drive and instead time to retire from driving. First is trying to reinvent the wheel. Reframe a concept of independence as an interdependence, and talking to a loved one about how everyone in the family may depend on each other. This individual just needs to depend on someone for them to help drive. Another thing that has a lot of impact for many patients is that shining a light on how their driving impacts other people. Telling them that we have a formal driving assessment that pointed out quite a few safety concerns. You continuing to drive puts other people at risk. What if you had a grandchild or a stranger who was hurt by you causing a car accident? That may be enough motivation for someone to stop driving. And then overcoming what this organization calls the first speed bump. It's difficult for an older adult to ask for a ride if they've never had to do that before. But the first time that they ask, if they can get through that, the other times after that first ask for a ride may become easier. So as a family member or caregiver, maybe anticipating that conversation of, I know you don't want to ask me for a ride, but let me offer instead. And then also think about alternate routes. Older adults often have to go out driving to pick up medications from a pharmacy or to go to grocery stores for errands. Can the pharmacy be set up so that medications are mailed directly to an older adult's home? Can we set them up on with a website or help from a loved one to order their groceries online so that those can be delivered to their home? And then just making yourself available to serve as a driver. So maybe if Friday is the grocery store day for an older adult, maybe setting up a time where another member of the family also goes to the grocery store on that same day. Then it's also important to bring the entire family along for this conversation. Once the decision is made that it's time to retire the driver's license, it's important for the whole family to be on that same page. This helps avoid arguments and also emphasizes the gravity of the situation. So it may, again, serve as more motivation to that older individual that it's time to stop driving. And then if you and your family need to buy some time while convincing a loved one it's time to give up the keys, there are also things like arranging for the car to be in the shop or temporarily unavailable. Sometimes it may be a conversation of, well, the brakes don't work, we have to take the car in to get it fixed. And it ends up being in the shop for days, for weeks, for months, and that may be enough that an older adult may forget and completely decide it's time to stop driving. Well, my car just stopped working and I didn't have another one, and that may be a way that they can accept that. Another thing that I always recommend, it's not a bad idea when you have that conversation of no more driving to involve a medical provider. I always tell, when we go over with patients and families in the office about no more driving, when we review that driving assessment, I always put it in writing, like a typed note of no more driving per Dr. Hart, so that if it's something that a family member needs to remind a patient or a family member of, well, it's not me that said you can't drive, the doctor said you can't. It's also ways of, again, pointing out some of those other risk factors that may have been identified. They may be more accepting of, well, I can't drive anymore because I can't see, or I can't hear the car horns anymore. Or maybe it's a physical disability that keeps them from driving rather than their memory. I think that was the last of the topics that I had wanted to cover with driving safety. So if there's any questions, I'm happy to take those.
And if you could, please put them in the Q&A chat box, and I will assist Dr. Hart in getting those answered. I'll give people just a minute to type. Somebody wants the slides. Can I send the slides out?
Yes, that's fine.
Okay. Okay, if nobody has any questions, I'm going to go ahead and wrap it up. Thank you so much, Dr. Hart, for your presentation today. It was a lot of good information.
All right, thank you.